everyone. Hi, friends. I hope you're having a great week. Thank you so much for tuning in. I'm Megan Blackford. I'm the social media manager here at FHE Health. And tonight I am very excited to be joined by Arielle Kanitz. Welcome.
Thank you very much for having me.
Of course, I'm excited that you're here and I'm excited to share more about our DBT program. Arielle is the director of our Dialectical Behavior Therapy program, aka DBT. And so tonight she's going to fill us in on how the program works and how it's helping our patients. And so if anyone has any comments or questions, please leave them below. There's a comment section that you can chime in on. We will look through everything at the end of our little Q&A.
Yes.
And if not, you can always email us. You can email me. I'm mblackford@fhehealth.com, and I will be happy to get your questions answered.
Excellent.
Great. Let's dive in.
All right.
Okay, so in layman's or woman's terms, could you please explain what DBT is?
Yes. Okay. So DBT stands for Dialectical Behavior Therapy, and I think it's important to kind of break down those terms to start. So dialectical is a kind of fancy philosophy word, and it basically means two seemingly opposing ideas can both be true at the same time. So how this can apply is we can both be happy and sad about something at the same time, right?
Absolutely.
So one of the things that we do a lot of times in DBT is try to find like the middle ground and try to find the gray area. So we're really trying to challenge looking at things through a very kind of black and white lens. We want to see things as gray. Behavior, obviously, our actions and our reactions. Therapy, obviously, right?
Yep.
So when we pull those all together, what you get is you get a therapy that is very kind of behavioral in nature, especially at the beginning, okay? So our main goals when we're first starting out in DBT is we're trying to identify behaviors that maybe we might be interested in trying to change. Either they're not really working out for us anymore, or we're kind of having some consequences in our life, so we want to kind of decrease them. So we kind of focus on bringing those behaviors down and replacing them with more effective, skillful behaviors. So we just learn a bunch of skills and try to improve the outcomes of our behaviors based on that. And then eventually we will kind of do a little bit of work around our thinking and try to kind of restructure our thinking, but that's usually a little bit later in the process.
One step at a time.
Yes, exactly.
Good. I mean, that's fascinating. My next question is, so is the treatment path or track different for someone who's suffering from a mental health condition versus substance abuse issues?
Okay, so the way that we have it here set up at FHE Health is currently our DBT track is offered within our Restore Mental Health program.
Gotcha.
So you basically, if you're in the Restore Mental Health program, you would, given a certain, kind of assessment process, you may qualify for DBT.
Okay.
So, but that doesn't mean that if you have substance abuse issues, it's just going to be ignored. So DBT as a whole, kind of broadly, let's say maybe not necessarily just within our program, but just as a whole, absolutely can treat both mental health diagnoses as well as substance abuse issues. Where it differs is sometimes the specific skills that we teach and that we learn. So there's actually a section of skills that are specifically for substance abuse. So you would kind of learn all the regular skills, the normal skills, and then add in some of the substance abuse skills.
That makes sense. Good. So what does a typical therapy session entail? How does that go?
Yes, so that's a good question because it actually looks different than what a lot of people would kind of consider to be a standard therapy session.
Sure.
So most of the time when we go into therapy, there's a lot of talking, there's a lot of processing, and sometimes we talk about our childhoods and we kind of talk about things that aren't always super comfortable. A DBT session is a little more targeted to kind of the skills. So it's a little bit more in the here and now, meaning that we're talking about, all right, what happened throughout the week? We review something called a diary card where people can track their behaviors, they can track their emotions, they can track their skill usage, and so you go over that with your therapist. And so the therapist's job is to help you kind of pick apart some of the patterns in your behavior and tie it back to emotions and tie it back to triggers and things like that. So it's very, very focused on the skills versus kind of just talking, if that makes sense.
Good. No, it's like solutions oriented.
Absolutely.
That's really exciting. Are there telltale signs in a prospective patient that, like, you know, at the beginning when you meet with them, you can tell right away, like, you would really benefit from DBT?
Yes. So DBT is the gold standard treatment for borderline personality disorder. Okay. So that is kind of the, I guess, diagnosis, you could say, for lack of a better word, that it was kind of developed for. However, over time, they've been able to expand it and apply it across a wide kind of population of patients. And what most people have in common that would benefit from DBT is essentially kind of having difficulties or struggles or kind of the wiring, so to speak, just internally, where their emotions are really high and low. Okay, so not necessarily mood swings, but more like emotion swings. So kind of having a strong emotional response to things and just being very kind of attuned emotionally. So, and then when having this emotional response, kind of feeling flooded and overwhelmed and not really sure how to handle them or what to kind of do with them, that's why we learn the skills. Is so that way when you have this strong emotional response, we're not resorting to some of those behaviors that maybe could be harmful or kind of have some consequences as a result. So those are kind of like the main things that we look for when we're assessing.
Great. Yeah, it sounds like something that a lot of people could really benefit from. I know I'm hearing like a lot of different things that pique my curiosity with DBT. So do people need to come back for treatments after they leave FHE? What does that look like?
So the way that we have it structured here is we really are trying to give all the patients that go into our program and complete our program a very solid foundation in DBT. So our program is 8 weeks long, and in those 8 weeks, every individual has an opportunity to learn like the main kind of like core skills that are taught throughout the kind of curriculum of DBT. Now, depending on the patient's situation, where they're from, their resources, things like that, we may then kind of refer for them to continue DBT on an outpatient basis. So if maybe we feel like they're in a place where they've kind of really reached the maximum benefit and now it's just about kind of going and doing some other types of therapy, then we might not necessarily recommend that they continue with DBT.
Sure. I mean, everybody's different.
Exactly.
So case by case basis, I get it.
Exactly. Yep.
Yeah. One thing, like when you talk about the skills, so mindfulness, what does that look like when they implement mindfulness? What does their daily practice look like? What do you recommend?
Sure, yeah. So mindfulness is a core skill set within DBT, and we really kind of think about it and refer to it as almost like the foundation of DBT. Okay. So, and a lot of people equate mindfulness with meditation, but the reality is that mindfulness is kind of like an umbrella and meditation is underneath that umbrella. So there's a lot of different elements that can make up mindfulness. So you don't have to like woosah to be mindful, okay? So there's actually 6 mindfulness skills that we teach in DBT. So the 6 skills are observing, describing, and participating. So what we would encourage is people to observe through their 5 senses, their present moment, describe it in a way that is very non-judgmental and kind of hands-off. You're just like labeling it, okay? And then participating is throwing yourself fully into the present moment. So whatever it is that you're doing, that's all that exists, basically. Then the other 3 skills are non-judgmentally, one mindfully, and effectively. Non-judgmentally, what it sounds like, right? Is having a very non-judgmental stance, not applying your assumptions or your history or your belief systems to the current moment and just taking it in as it is. One mindfully means one thing at a time. So if you're walking, walk. If you're eating, eat. If you're drinking water, drink water, right? Nothing else exists. It's just this one thing in this moment. And then effectively is kind of like the Nike slogan of like, just do it.
Yeah.
So even if you don't like it, let's say, if the present moment is calling for something in particular and you just kind of have mindfully seen what's going on and you're aware of what's going on and this is what's called for, is just doing it anyways. So essentially, if you are doing all 6 of those skills, literally anything can be mindfulness. Like right now, I'm practicing mindfulness by being here fully in this moment. So I can, check off and say that I've done that today. I don't have to go home now and meditate for 10 minutes.
But you're probably not multitasking while we're here
not
chatting. You're not thinking about the umpteen different side projects, and I would imagine that contributes to a lot of distraction and stress in people's lives. So I think, again, like we were talking about earlier, there are a lot of different skills that I think are universally applicable for people in their lives.
Absolutely. I think mindfulness, what I strongly suggest people to do is to not try to overdo it. You know what I mean? Like, it's something that is a skill set. So whenever anything is a skill set, it means it can be learned. It means it can be practiced, and it learns that eventually you can become an expert at it, right? So I would not expect, I don't know if you play the piano, but I wouldn't expect you to go out and I certainly would not expect you to go out and be like a concert pianist tomorrow, right? Like, it's going to take time to get to that point. So same with mindfulness. So don't feel like if you weren't able to, reach like the higher realms and kind of reach enlightenment by next week, doesn't mean that you're failing. It takes practice and it takes time to kind of work your way up to that.
Sure. And I think everybody kind of naturally has their strengths and weaknesses.
Absolutely.
But I think it's really empowering to see yourself progressing and working on the areas in life that you want to improve upon.
Yeah, absolutely.
So, yeah. I guess you talked about the program being 8 weeks. How long, do some people respond really quickly? Do people, what does that look like?
Well, like you had mentioned earlier, it is everyone's different, right? It's a case by case. So DBT as a program, kind of the core program outside of FHE is really, it's a kind of outpatient model. So typically the treatment lasts anywhere from 6 to 12 months. However, because of some of the flexibility of the skills and things like that, you are able to adapt it to make it work for shorter time periods, which is exactly what we've done. So some people, they go through the 8 weeks and we see some pretty significant changes, or perhaps maybe they were coming in and they just needed guidance in a few different areas. So we can see changes relatively quickly. I think that if there are people who need additional guidance and maybe would benefit from kind of ongoing skills training, that we can see can take some time. The way I see it is, if people are coming into treatment and they've been engaging in X, Y, and Z behavior for 10, 15, 20 years, I mean, I don't expect there to be this significant change in 2 months' time. Like, there's a lot of patience kind of in the process, and we encourage patience for self as well as practitioners. We are patient and we understand that it takes time.
Of course. And you're the expert in this field. I know that you were saying that you are certified, and that's one of the things that is so exciting about our program.
Yeah.
Could you talk a little bit more about your education?
Sure. Yeah.
And what it entails?
Yeah. So I'm a licensed clinical social worker, meaning that I have a license to practice therapy in the state of Florida. I also hold licenses in a couple other states. But I made a decision along the way to kind of expand my education after I kind of got my license and I had completed some training in DBT, and I decided to go for certification. So a certified DBT clinician, there's a long process. There's a lot of steps, but essentially what it means is, and what it indicates to someone who maybe is looking for a DBT therapist, it means that anyone who has the certification through the Linehan board, and Marsha Linehan is the developer of DBT. She was the one who founded it, and so she has a board of certification that gives out these certifications. So what it means is that we have years of extensive training, we have years of practice and experience. I had to, in order to get certified, I had to take a rigorous exam. I had to tape record sessions with real patients to verify that I was giving the therapy the way it's designed to be given. And after all of that, you get the certification, and basically what it means is that as I'm executing therapy, that kind of indicates that I'm doing it in the way that it's designed to be. So it's being done to fidelity. It's being done to the way that it's designed to be done. So, and it's all evidence-based, and that's how we run our program here at FHE.
Well, we're so lucky to have you here, and I'm so appreciative to have you educating all of us. I've been really curious about the program for a long time. Our colleagues keep raving about you, and this is my first time actually meeting you today. So
I appreciate that.
Yes, thank you again for being willing to do this.
Absolutely.
And we should just check and see if we had a couple of viewers. I don't see any comments, but I will be sure to check everything tonight. And thank you so much to everybody for tuning in. Please keep an eye on our channel. We just started a new TikTok earlier this year, and we post videos every Thursday. So I look forward to seeing you on TikTok. And take care, everyone, and we'll see you soon.
Thank you.
Yeah, thanks so much.
Yes.
Bye, everyone.